everyone. My name is Dr. Beth Brooks, and I'm the clinical advisor here at Vivian Health. And today I want to talk about the Employee Assistance Program. Historically, employee assistance programs have been underutilized by our employees and often are just not understood about what the services are that they provide. And this is probably a really great time to take advantage of the services of the Employee Assistance Program for all of your team members. And in fact, there was a study done by the American Organization of Nurse Leaders asking about what was the number one concern of nurse executives. And 75% of them responded it was the emotional health and well-being of their staff. So this is a good time to think about what and how to appropriately use your employee assistance program. So we've been through a really tough period. We've got nurses with high levels of exhaustion, of burnout, of stress, and of fatigue, feeling undervalued, nurses re-examining their careers, rethinking about their work-life balance. And it's clear that not one solution is going to help our nurses sort of recover from the pandemic, that we need a multitude of different approaches to help them recover from a really mentally taxing and physically taxing time. So unfortunately, EAPs are underutilized. There's some data here that only 10% of employees will use the Employee Assistance Program. And when we did some study earlier last year here at Vivian Health, we learned that 65% of our registered nurses did not feel like the organization was doing enough to support their mental health. And so we have an opportunity to do a better job. Nurses were not able to take vacation time, weren't able to take PTO time. So now is a really good time to take a look at that employee assistance program and see what kind of services they offer. And perhaps this might be the time to ask if there are some new services that have been introduced, and can that program that is provided to your employees be customized? As you know, employee assistance program is an employee benefit, and every employee and typically their family is eligible to participate. Employee assistance programs offer health and wellness programs, mental health programs, safety, performance improvement. They can help with critical incident reports. They can help with fitness for duty and substance abuse disorder. So there's a wealth of programming that comes from the employee assistance program. And so bringing a team together from, let's say, human resources and employee health and your nursing team, and having a conversation with the employee assistance provider to see if there aren't some enhancements or some changes that can be made to that program. And one of the things that often can be difficult for employees to remember, or maybe they're fearful, is that thinking that there's going to be some kind of retaliation against them, or that their boss will know that they've gone to the employee assistance program. So it's always worthwhile to re-stress with employees that the employee assistance program is free of charge, included in their benefits. It includes assistance for their family, and it is a confidential service. Sometimes services are offered in groups, which could happen on your campus. Sometimes services are one-on-one, which can be done either in person or on Zoom. There's a lot of new programming that is groups on Zoom. So making sure that there's the right mixture of programs that are on site, programs that are off site to protect that confidentiality, and then any kind of online programs, whether it's one-on-one or group programs that might be available to your employees. One of the things too that I think is important is to re-communicate with your team about the availability. As I said, the utilization rates for employee assistance can be as little as 10%. And so many employees don't always realize that that benefit is available to them. So sharing that that's available, working with your vendor or your provider of EAP services to keep track of certain metrics. Which services are used most often? Is it online, in person? Is it group therapy or group programming or workshops that are about health and wellness? And so understanding better which services are more highly utilized versus others that aren't. And of course, you would always keep this data confidential and never attach any one metric to any one employee. So this is, again, a good time to reinvigorate or reinstitute or recommunicate about your employee assistance program. And sometimes employees even just need help navigating your healthcare insurance benefit. And so this is a great opportunity for the employee assistance team to become involved in helping employees navigate through their healthcare benefits. So again, think about talking with your EAP vendor. Think about, is there a way to customize some of the programming to meet the specific needs of your workforce? And just encourage folks to take advantage of this benefit because it's often well worth the time and effort. And especially as we've come out of this pandemic now, helping nurses and the rest of our healthcare team members recover from what's been a really challenging few years. So I'd like to thank you today for joining us here at Vivian Health. And if you have any questions or comments or need further information, please call us at hire.vivian.com. Thank you.